morning, everyone. Welcome to this tutorial right here at Get Ahead Institute. And in this anatomy tutorial, we are going to go over 20 multiple choice questions which will be explained with key principles or concepts. Let's get into this. So, question 1, the mediastinum. The mediastinum contains the following except. So in other words, all the options which have been listed here, they are found in the mediastinum, but among these options, one is not part of the mediastinum. So to start with, you need to understand that the mediastinum firstly is divided into the superior mediastinum and the inferior mediastinum. Then the inferior mediastinum is further subdivided into anterior mediastinum, middle mediastinum, and the posterior mediastinum. So it is very significant that you know the boundaries of each compartment of the mediastinum and all the contents which are found in that specific mediastinum compartment. So with regards to this question, the answer basically is B. So our answer to question number 1 is B, in the sense that as we are aware that the mediastinum is basically the central aspect or the central compartment of the thoracic cavity. It basically does not contain the lungs. It has the heart, it has the thymus, it has the trachea, the esophagus, and other various significant vessels and nerves. So the lungs are located in the pleural cavities on either side of the mediastinum. So the answer here is B. Question number 2, still on the mediastinum. The question says, the anterior mediastinum contains the following except. The anterior mediastinum contains the following except. Okay, so anterior mediastinum contains the following except. Okay, so you need to understand, first of all, our answer to this question is A. The answer to this question is A. Okay, so the anterior mediastinum, which is a subdivision of the inferior mediastinum, basically contains um, various contents which include loose areolar tissue. It also has some lymphatic vessels which basically ascend from the convex surface of the liver. We also have mediastinal lymph nodes, which can be 2 or 3 of them. We also have the small mediastinal branches of the internal thoracic vessels, as well as the remnants of the thymus, especially in children. Um, we also have the sternopericardial ligaments. Okay, so all those are found in the anterior mediastinum. Okay, so coming to the vagus nerve basically passes through the posterior and the middle mediastinum, not the anterior mediastinum. Okay, we go to question number 3. Question number 3 says, which of the following is not the content of the posterior? So we're looking at what is not part of the posterior mediastinum. So the options given, we have thoracic aorta, esophagus, azygos, and the phrenic nerves. So it is very, very important for you to understand that the contents of the posterior mediastinum, which is also a subdivision of the inferior mediastinum, basically include um, things like, when you talk of the organs, you have the esophagus. Okay, when you talk about the arteries, you have the descending thoracic aorta. Then when you talk of the veins, you have the azygos, you have the hemiazygos, and also the thoracic duct. Then for the then for the nerves, okay, then for when it comes to the nerves, basically we have the vagus nerve, you have the splanchnic, including the sympathetic chains. So those are part of the uh, posterior mediastinum. So in this case, our answer to question number 3 is D. Okay, the phrenic nerves are not part of the posterior mediastinum. We go to question number 4. Question number 4 says the parietal pleura basically covers the parietal pleura covers the that is question number 4. Okay, so to start with, you need to understand that first of all, the question is, where is the pleura located? Where is the pleura located? So you need to understand that the pleura basically is the one that lines the chest wall. Okay, the pleura is the one that lines the chest wall. Okay, so the pleura lines the chest wall, which is the thoracic wall. Okay, so this pleura basically covers the surface of the lungs. Then you need to understand that the pleura contains layers. We have two layers of the pleura. You have the visceral pleura, which is basically the inner layer of the pleura, and it covers the lungs, it covers blood vessels, it covers the bronchi, including the nerves. So one of the important things that you need to take note of as far as the visceral pleura is concerned is that this visceral pleura doesn't have sensory nerves. As a result, it is not sensitive to pain. Then the last layer, which is the second one, is what we call the parietal pleura. So the parietal pleura basically is the outer layer of the pleura, and this one attaches to the chest wall. It attaches to the chest wall, and it is also sensitive to pain. Okay, so the parietal pleura, just like I've already explained, is it covers the inner wall of the thoracic cavity. Okay, so our answer is A. We go to question number 5. Question number 5 says the following are parts of. So the following are parts of the upper respiratory tract. The upper respiratory tract except, okay, the upper respiratory tract except, okay. So you need to understand that the upper respiratory tract basically comprises of the nose, paranasal sinuses, the pharynx, okay, and then when it comes to the lower respiratory tract, the lower respiratory tract contains the larynx, the trachea, bronchi, and the lungs. So the answer to this question is D. The answer to this question is basically D. Okay, we go to question number 6. We go to question number 6. Question number 6 says the conducting zone. Question 6 says the conducting zone of the lungs includes all of the following except includes all of the following except. Okay, so we have respiratory bronchioles, alveolar ducts, alveolar sacs, terminal bronchioles. So our answer um, to this question has to do with C, alveolar sacs. Okay, so you need to understand that the alveolar sacs are part of the respiratory zone, not the conducting zone, because the conducting zone includes the respiratory bronchioles, the alveolar ducts, and the terminal bronchioles. We go to question number 7. Question number 7 says, which statement which statement is correct concerning the trachea? Which statement is correct concerning the trachea? Statement is correct concerning the trachea. So on the first option that we have, um, we are being shown that the trachea is lined by squamous epithelium. The trachea is lined by squamous epithelium, of which is not correct. The trachea is not lined by squamous epithelium because the trachea is lined by pseudo-stratified ciliated columnar epithelium. Then B is saying the trachea has C-shaped cartilage on the posterior aspect, So this statement is incorrect in the sense that the trachea, yes, it has the C-shaped cartilage, which is anteriorly and not posteriorly. Then option C is saying the trachea is 20 centimeter long, 20 centimeter long. So this figure basically is too exaggerated because approximately the trachea is around 10 to 12 centimeter long, that is in adults. Then option D says the trachea extends from C6 to T5. So this statement is very much correct in the sense that when we look at the cervical part of the trachea, the trachea starts at the inferior border of the cricoid cartilage, which is just at the level of the sixth cervical vertebrae. Then when you look at the thoracic part of the trachea, basically this one which is as far as the location of the trachea is concerned, it starts at the superior thoracic aperture and then it ends at the tracheal bifurcation, and this point is usually at the level of T5. So among the four statements which have been made regarding the trachea, D stands to be the most appropriate statement. We go to question number 8. Question number 8 says, um, which of the following muscles is a deep muscle of the posterior compartment of the arm? Posterior compartment of the arm. Question number 8. So our answer to this question is going to be C. Then we go to question number 9. We go to question number 9. Okay, so question number 9 says the following muscles flex the wrist except the following muscles flex the wrist except. Okay, the following muscles flex the wrist except. So you need to understand that there are we have six main flexors of the wrist. We have six main muscles that flex the wrist, and those muscles can be categorically put into three groups. We have the first three, which originate on the humerus, and they'll cross the forearm and extend through the wrist via tendons and then insert into the bones of the hand. And these muscles in the first category include the flexor carpi radialis, flexor carpi ulnaris, and the palmaris longus. Then the other category has to do with those muscles that start in the forearm and the tendons, their tendons basically attached to the phalanges. So as a result, you discover that where these muscles insert, they are able to help with flexing the wrist as well as flexing the respective finger or thumb where they attach. So these muscles basically in the second category, they include flexor digitorum superficialis, flexor digitorum profundus, and flexor pollicis longus. So which among these muscles is not a flexor of the wrist, is not a flexor of the wrist? So basically, the answer here is C, pronator teres. We go to question number 10. Question number 10 says, which of the following is a hybrid muscle? Which of the following is a hybrid muscle? Okay, so when we talk about a hybrid muscle, the other name for hybrid muscle, we can say composite muscle. So hybrid muscles basically are just muscles which have more than one set of fibers, okay? Have more than one set of fibers but perform the same function, and they are usually supplied by different nerves for different set of fibers. And examples of hybrid muscles include the brachialis, the adductor magnus, the biceps femoris, the pectineus, the flexor digitorum profundus, flexor pollicis brevis. You have the iliopsoas muscle, including the pectoralis major. So those are the uh, those are the examples of hybrid muscles. So um, from the options that have been given, the hybrid muscle that is an example here is flexor digitorum profundus. Flexor digitorum profundus. We go to question number 11. So question number 11 basically is about the following muscles abduct the wrist except. Okay, the following muscles abduct. Okay, so this has to do with abduction of the wrist. This has to do with abduction of the wrist. So the following muscles abduct the wrist except. So we have on A, we have extensor carpi radialis longus. On B, we have extensor carpi radialis brevis. Then on C, we have the flexor carpi radialis. Then on D, we have the flexor carpi ulnaris. So firstly, to start with, um, there are various muscles um, which help with the abduction of the wrist. Okay, so you will discover that when we talk, for example, when we talk about the abductor pollicis longus, so the abductor pollicis longus basically functions to abduct the thumb at the carpometacarpal joint. It also helps in extending and rotating the thumb. Okay, but um, when we talk of the abduction of the wrist is also known as radial deviation. Radial deviation simply because the hand moves towards the radius or the hand moves laterally. So we have the main muscles of uh, which have to do with abduction of the wrist. These muscles include the flexor carpi radialis. Okay, you have the flexor carpi radialis. You have the extensor carpi radialis longus. You have the flexor carpi radialis brevis. So, among all those um, options, basically our answer is supposed to be D on question number 11, because this flexor carpi ulnaris basically does not abduct the wrist. Instead, it adducts the wrist. So we go to question number 12. We go to question number 12. So the question says the posterior the posterior interosseous nerve innervates the following except. So this is about the posterior interosseous nerve. You need to understand that we have the anterior interosseous nerve and the posterior interosseous nerve. So just to mention with regards to the anterior interosseous nerve, it supplies the flexor pollicis longus. It also supplies the flexor digitorum profundus as well as the pronator quadratus. Now uh, go back to um, let's go back to the posterior interosseous nerve, which is in the question. Okay, so the posterior interosseous nerve basically gives sensory um, uh, functions to the posterior uh, wrist joint capsule. Okay, so this muscle, as far as sensory functions are concerned, it does not supply any cutaneous innervation. Then when it comes to motor functions of the posterior interosseous nerve, the posterior interosseous nerve basically supplies motor innervation or motor sensation to to most of the muscles in the posterior compartment of the forearm. So when it comes to the muscles which are innervated by the posterior interosseous nerve, the superficial compartment of the forearm, which receives the muscles of the superficial compartment of the forearm, which receive innervation from the posterior interosseous nerve, include extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, extensor carpi ulnaris, then the deep compartment which receives innervation from the posterior interosseous nerve include the abductor pollicis longus, extensor pollicis brevis, extensor pollicis brevis, extensor pollicis longus, extensor indicis proprius. So now, uh, on this particular question, it wants us to bring out the muscle that is not innervated by the posterior interosseous nerve. Okay, by the posterior interosseous nerve. So, um, on the options that have been given, we have so there are a lot of muscles which are innervated by this posterior interosseous nerve, and even the supinator is part of those muscles. The extensor indicis is part of those muscles. Extensor carpi ulnaris is part of those muscles, and then when it comes to the extensor carpi radialis brevis, extensor carpi, okay, extensor carpi radialis brevis. So we said that it would have been um, if we had extensor policies brevis like that. But so this is our answer to this question. We go to question number 13. Question number 13. Question number 13 says, which of the following muscles is innervated by the ulnar nerve? Which of the following muscles is innervated by the ulnar nerve? So on this one, very straightforward, our answer is D. We go to question number 14. Question number 14. Question number 14. So question number 14 is about hyaline cartilage. Okay, hyaline cartilage. So the question says the following are sites of hyaline cartilage except the following um, hyaline cartilage except. So it is very, very important to take note that um, on this question, our answer is supposed to be B. Our answer is supposed to be B in the sense that the epiglottis is not made up of the epiglottis is not made up of the hyaline cartilage. Instead, the epiglottis is made of elastic cartilage. Okay. Then when we talk of the costal cartilage, the nasal septum, and the tracheal rings, all of them contain hyaline cartilage. Okay, we go to question number 15. Question number 15 says, which statement is correct regarding spongy bone? Regarding spongy bone. So A is saying it is also known as lamellar bone. This statement is false. B is saying trabeculae has spaces filled with bone marrow. Okay, for now we can skip this option. Then C is saying spongy bone has high mineral content. Okay, then we go to D, which says has lower proportion of osteocytes than compact bone. So our answer to this question basically is supposed to be B. Okay, our answer is supposed to be B, which is trabeculae has spaces filled with bone marrow. So spongy bone basically contains trabeculae with trabecula which has spaces that hold bone marrow. For the lamellar bone is not as this are the same as the spongy bone. Okay, and when we talk of spongy bone has a lower mineral content and higher osteocyte proportion compared to the compact bone. Okay, we go to question number 16. Question 16 says, which of the following is not a derivative of the ectoderm? So our answer to this question um, is D, vertebrae. So we have skin, sweat glands, breasts, and vertebrae. So we are going to go for vertebrae. Okay. So the vertebrae are basically derived from the mesoderm, while the skin, sweat glands, and the breasts are of ectodermal origin. We go to question number 17. We go to question number 17. So question number 17 says, at the caudal end of the embryonic disc, the ectoderm and the endoderm will fuse to form what? So we have buccopharyngeal membrane, cloacal membrane, notochord, primitive streak. So to this question, our answer is going to be B, which is the cloacal membrane. Okay, we go to question number 18. Question number 18 says lateral plate mesoderm gives rise to the following except. Lateral plate mesoderm gives rise to the following except. Okay, so these have to do with derivatives of of the germ layers from the germ layers. Okay, so just to mention one or two things, we have the endodem. Okay, we have endodem, you have ectodem. Okay, so the endodem basically will give rise to the yolk sac. The endodem will give rise to the primitive gut. In the primitive gut, that is where we are going to have our gut, the liver, the pancreas, the lung, the digestive tube. Then when we talk about the ectodem, so the ectodem basically is going to give us the epidermis, um, the neurotubes. Okay, so on the epidermis, we are going to tag it together with the skin, the hair, mammary glands. Um, then we also have epidermal placodes, okay, which include the lens, inner ear, um, just to mention a few. Then when we come to the mesoderm, okay, when we come to the mesoderm, in line with this question, very, very important. When we come to the mesoderm, so the mesoderm, we have the axial mesoderm, which gives us the notochord. Okay, axial mesoderm will give us the notochord. Then we're going to have the paraaxial mesoderm. So the paraaxial mesoderm will give us the sclerotome. Okay, will give us the myotome, will give us the dermatome. Okay, so myotome will give us skeletal muscle, then the dermatome will give us connective tissue of the skin. Then we also have the intermediate mesoderm. So the intermediate mesoderm um, will there we're going to have the uterus, the oviducts, we are going to have the kidneys, we have the ovaries and the testes. Then from the lateral mesoderm, we are going to have the somatic and the visceral mesoderm. Okay, so from the mesoderm as well, we're going to have we have the head. Okay, so in line with this particular question, on question number 18, our answer is going to be costal cartilage. Okay, so costal cartilage um, is derived from the sclerotome, which uh, of which we've already said that this sclerotome comes from the paraaxial mesoderm, not the lateral plate mesoderm. Okay, we go to question number 19. Question number 19 says extra embryonic mesoderm is found between extra embryonic mesoderm is found between A, you have epiblast and hypoblast, B, syncytial trophoblast and cytotrophoblast, C, you have exocoelomic membrane and cytotrophoblast, D, you have exocoelomic membrane and syncytial trophoblast. So our answer basically here is going to be C. We go to question number 20. Question number 20 says, which germ layers are present at the end of third week of development? Okay, so this is very simple. Our answer is going to be C. We are going to have ectoderm, mesoderm, and endoderm. So it's very important to understand that by the end of third week, the three germ layers, ectoderm, mesoderm, and endoderm, are established through the process that is known as gastrulation. Thank you very much. Wishing you all the best in your exams and your assessments.